So for the pathophysiology of acute otitis media, when we have the modifiable risk factors, which are the age around 6 to 12 years old, male, family history, and low birth weight. So for modifiable, we have the upper respiratory infection, bottle feeding, and smoking exposure. So for the disease process, we have the viral or bacterial infection that happens in few days. So there will be initial inflammatory response wherein this will cause congestion and swelling of nasal mucosa of nasopharynx. The eustachian tube will be blocked due to inflammation that leads to impaired ear ventilation and secretion drainage. Then, air is absorbed by surrounding tissues wherein there will be a creation of negative pressure in the middle ear. This will have two mechanisms. On the left part, negative pressure pulls the tympanic membrane inward, that effusion accumulate behind tympanic membrane. So for the right side naman po, the negative pressure draws fluid into the middle ear, which is transudation, wherein there will be accumulation of fluid and secretions. So both of two mechanisms, it will create an ideal environment for microbial growth. Then bacterial or viruses invade the effusion. Both of two mechanisms creates an ideal environment for microbial growth. Then bacterial or viruses invade the effusion. Next is bacterial proliferation or virus replication, which is the medication would be amoxicillin. Then immune cell recruitment and immune cells flood the area, which releases the inflammatory mediators, which could also lead to fever to our patient. So there will be three mechanisms for that. So first, on the left side, we will be starting on the left. The vascular permeability will increase and will have further fluid exudation and fluid accumulation. On the middle of disease process, the immune cells continuously fight off pathogens and cellular debris form from dead immune cells and bacteria or virus. And then on the right part, there will be the mucosal changes leads to inflamed of lining and increase of mucus production. So after that, there will be effusion of purulent, which is the patient will be having purulent ear discharge. So since there will be overly increased pressure inside the middle ear, the patient will experience ear pain, and the medication would be acetaminophen or the analgesics. The tympanic membrane will continue to have edema causing bulging, which leads to our acute otitis media. So starting for the signs and symptoms, nursing diagnosis and the management. So the patient will experience fever and medication. Then we will be giving ibuprofen, and the nursing diagnosis will be hyperthermia related to infectious process, and for the management is tepid sponge bath, administer antipyretics as needed, increase fluid intake, monitor vital signs, and watch out for signs of dehydration. Next is the redness and swelling. So we will be applying warm compress, administer anti-inflammatory as prescribed, and keep head elevated. So for the management, we have to assess for PQ or ST of pain, observe for nonverbal cues, and provide emotional support. Then we can also administer analgesics as prescribed, and we encourage the patient to rest and for diversion technique. For the bulging of tympanic membrane, this is a risk for infection related to accumulation of fluid behind the tympanic membrane, and for our management is to monitor for changes in the bulging of the tympanic membrane and monitor for pain. So for the diagnostic test, this will be otoscopy. So on the left part of our pathophysiology, the purulent ear discharge, nursing diagnosis will be impaired tissue integrity related to inflammatory and infectious processes for the management. So observe for characteristics of discharge, assess for skin breakdown around the ear. We have to note for pain and clean the external ear. Apply warm compress to the affected ear. Administer antibiotics as prescribed, and we have to provide emotional support to our patient. So for acute otitis media, the medical test will be insertion of ventilating tube and myringotomy, or yung tympanotomy. So if this is left untreated, or the acute otitis media is left untreated, this will lead to some complications, such as the intracranial abscess, the facial nerve palsy, mastoiditis, and chronic suppurative otitis media.